and comments of the hosts and guests are not necessarily those of the station.
Hi, I'm Nicole, Jacinto. Join us on Healthline with 𝗏𝗏𝗁 as we discuss the latest health and medical topics with doctors from 𝗏𝗏𝗁. For a healthier and uplifting lifestyle, tune into Healthline with 𝗏𝗏𝗁 on 𝗛𝗏𝗰 8:10 a.m. Radio Bandido TV. You've got questions, we've got answers.
Watch and listen to Healthline with 𝗏𝗏𝗁 every Monday from 5 p.m. to 6:30 p.m. airing on Sky Cable Channel 224 and on all DTT boxes, simulcasting online on Facebook and YouTube. Listen and watch on your mobile devices. Just search 𝗛𝗏𝗁 Radio Bandido.
You're about to experience Healthline, a show where doctors from 𝗏𝗏𝗁 interact with you for a healthy, uplifting lifestyle. Moderated by Nicole Jacinto. You've got questions, we've got answers. So welcome to Healthline.
Hi, everybody, and welcome to Healthline with 𝗏𝗏𝗁. I'm your host, Nicole Jacinto. Today, we're going to talk about hair transplants. That's right, hair transplants. It's a bad hair day for me. I didn't do it on purpose, but it's a bad hair day for me. And today we have with us Dr. 𝗠𝗸𝗁 She's a dermatology specialist. Welcome to the show, doctor.
Hello, Nicole. Hello, everyone. Good afternoon.
Thanks for being on the show. I mean, this is a great topic. We've never done it before. I'm sure a lot of people would want to hear about it. A lot to learn. I have a lot to learn from this topic as well. And as most doctors whom I've interviewed before know, I love learning. So if you will indulge me with some of my questions, I mean, I love learning, not necessarily calculus or something else. I mean, I wouldn't mind, but I don't think I have the, anyway, attention span for that sort of thing. Okay, doctor. Welcome again. We're talking about hair transplants. And before we go to talking about transplants exactly, can you tell us, can we just start off by talking about hair loss, no? And people who experience hair loss, just out of curiosity, obviously we're, well, not obviously, but I wanted to ask you, we're going to confirm, we're talking about hair transplants for the hair on the top of our head, yes?
Correct, yeah.
All right, but when it does happen, when people experience hair loss, does it happen on any other parts of the body as well? Or is it just specifically the top of the head? Or like, you know, I mean, this is sort of related to kind of like cosmetics or aesthetic sort of, the aesthetic part in many ways, the aesthetic aspect of what people want. And of course, that also spills, you know, emotion, self-confidence, psychology, all of that.
Right.
But does it, do people experience hair loss anywhere else in the body?
So Nicole, yeah, they do. But before I go into that, so there are different types of hair loss. So you could have the type of hair loss that is inherited, which is your androgenetic alopecia, your male or female pattern hair loss, which means that if you look at your father or you look at your mom, grandfather, or your uncles, and you see that they have a type of hair loss where they lose their hair from the front to the back, which we would say like, oh, na kakalbo na, or the person is bald. That's a genetic type of hair loss. But there's also the type where it's just diffusely thin. Like you start thinning out or you experience more hair shedding. It's totally different from the genetic type of hair loss. When you have extreme shedding, it can be caused by, for example, stress, vitamin deficiency, pregnancy, if you're taking some type of medication. So that type of hair loss naman is not addressed with hair transplant. And it's a more like a diffuse type of hair loss that doesn't only happen on the scalp. So it can happen in your eyebrow, can happen in your beard also. So in other parts of your body. Another type of common hair loss, which is we can see in children also, is your alopecia areata, or what most people would know as pocknut. You know how you lose like a coin-shaped type of hair loss, like there's like a coin-shaped bald patch on your scalp, usually precipitated also like by stress, or it's connected to another autoimmune disorder like thyroid, lupus. So that's another different thing, which is also not addressed with hair transplant. But the alopecia areata or the pocknut, you can see that not only in your scalp, you can see that some patients would experience it in their eyebrow. They lose a patch of their hair in their eyebrow, or even their beard, or even the private area. They can lose some hair there, like a bald patches.
Thank you, Doctor. That was great. You actually answered the a few questions I was gonna ask. So one is, okay, hair loss. You do experience it in different parts of the body, but it depends on what kind of hair loss.
Correct.
It can be genetic. Now, when it's in genetic, when it's a genetic type of hair loss, like male pattern baldness, or I don't know if they still call it that. It's been a long time since I've,
Yeah, they still call it male pattern hair loss.
Why would they change it? Okay, Nicole, why would they change it? Yeah. Okay. So, if it's genetic, that is mostly what you can address, meaning on top of the head. And the other part, like hair loss, can also be due to it can be due to an illness itself, or maybe secondary to an illness, to another type
Yes.
that's not completely related. And is it also environmental? Can that happen? Well, yeah,
Yes, it can also be environmental.
or unless you're like suddenly exposed to the gamma rays and you become a superhero but lose your hair, that type of thing. Okay, let's get off the comic fantasy thing, but get back to reality and talk about hair transplants. Okay, so doctor, thank you for telling us what you can address, or what you usually address with the hair transplants, and the things that, or the kind of hair loss that you don't address. Um, and thank you for answering the question, because yes, it can happen on other parts of the body. I mean, I would suppose that for some who have chest hair and they want some, there could be patches or not, and even in the pubic area or the private parts. How about the other
Yes.
that happen as well? Just out of curiosity.
Yes, it can happen anywhere.
Anywhere.
Even your armpit hair. Yeah. Arm hair also.
Arm hair also, yeah. I bet you some people are probably saying, why can't it happen in the areas that I want it to happen? Because there is such a, it's part of, I think, sorry, blah 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 blah, world culture now, to kind of remove hair from areas, from certain areas of the body, but want to keep hair in certain areas.
That's true. It's quite cool. It's a cultural thing. So what might be pretty for us, or what might be beautiful for us, is actually not good for like other cultures. Some cultures would appreciate hair in certain areas like their eyebrow that we don't. Like for example, the unibrow, or more hair on the private area. So in other cultures, that might be considered beautiful, but for us, of course, it's not.
Yeah.
It's not the conventional thinking for us.
Yes. And the hair, I mean, being let's say more natural with where the hair grows these days is more, it's sort of like acceptable, or people like to embrace that more now. But I think for a certain age demographic, we still prefer the, like, sort of, we don't like the too much hair in the eyebrows, and
Yeah.
like we like to beautify ourselves, and yeah,
Yeah.
plucking my eyebrows because it was just too difficult. No, I heard that. Is this true? Okay, like coming from a dermatology specialist like yourself, that your eyebrows eventually kind of fall out, like some of it, as you get older. So
In a sense, yes, but it's because when we get older, our hair, the lifespan of our hair on the skin becomes shorter. So back then, probably the lifespan, or the length of time that your hair is rooted in your skin, is around 6 years, let's say 3 to 6 years. But when you get older, it becomes less and less up to the point that it becomes 6 months to a year. So really, your hair doesn't have time to become thicker, doesn't have time to become an adult hair. So it just becomes thinner and thinner until you eventually like notice that, oh, it doesn't look as thick as before. It's because really the hair doesn't have time to thicken out.
That's
Not really naman na it's falling out.
falling out. Okay. Thank you, doctor, for answering those questions. I see we've got some of the audience hook now. Okay. We'll get to that question later. Thank you for sending that in. Okay. So doctor, can you tell us exactly is there a cure for hair loss other than a hair transplant? Is it considered a cure in scientific terms, or is it a remedy? Like, I mean, some people might try like topical things, nutritional things, or therapy.
The thing kasi with hair loss, like androgenetic alopecia, the one that is treated with hair transplant, it's progressive.
Okay.
It's a progressive type of hair loss. And medications, like for example, topicals like minoxidil, or some people might have heard of taking anti-androgen like Propecia or finasteride, which blocks their hormone, dihydrotestosterone. Those medications, topicals, stem cell therapy, injections, the things that are quite new now, like exosomes, the way that they address the hair loss is it delays the process, but not really to cure it.
Okay.
It just delays the inevitable up to the point that you reach a certain age na you don't really mind.
Yeah, okay.
But kasi with hair transplant, it's like a one-time thing that when you do the transplant, you can see the result and you're not delaying anything. You're
Okay.
putting back, or because with hair transplant, you're using the hair that you have on the back and on the side, because these hairs are, in hair transplant terms, your permanent hairs. Because
Okay.
they're not affected by the hormone that causes the hair loss.
Right. Okay.
So you're redistributing that hair to the areas where you are bald to give it more volume.
Okay. All right.
So it's more like a permanent type of solution. Kasi you know that it's not gonna fall out. It's permanent hair.
Thank you. Thank you, doctor. So at least that answers people's questions out there, like, oh, why shouldn't I just use topical creams, or, I don't know, whatever's coming out, some supplements or different medications, as you said. But as you said, that if for something that is progressive, that will simply delay it until the point where either it doesn't matter anymore, or you will not, you won't have that. Is there a window of time that you need? Actually, why don't you tell us first what a hair transplant exactly is? You kind of explained it already, but what happens, like just an overview of what you do when you transplant hair.
So the theory behind hair transplant is that you have hair on your back and on the side that is not influenced by dihydrotestosterone. Dihydrotestosterone is basically that hormone that causes your hair loss. So you notice that if older people who are bald, they don't really become completely bald. They still maintain their hair at the side and on the back. That looks like a little bit like a donut. So the theory behind hair transplant is that you get that hair that's permanent either by taking it one by one or getting the conventional strip, and then redistributing or planting those hairs one by one on the area where you are bald.
Okay. And it's usually the areas where people get bald. They're usually like the front, the hairline, and maybe on top of the head. Is that?
So it's usually front, top, or the crown, like what you said.
Yeah. And then you get the hair either one by one from, like, let's say the back of someone's head or the lower part.
On the patient's own head, not on another person, from another person.
To clear that up, you always transplant from somebody's own head, not
Correct.
someone's
Yeah.
head. I'm sorry. I find that I have to be a little bit more specific with when we come to this topic about talking about things. We can't take like information for granted. So, from a person's own head, um, you get it from like the sides where we would call it maybe the patilla or something, or a little bit over the
Yeah.
ear. There, okay, and then also underneath, yeah, the nape or the buttock, and then okay, when you transplant the skin also, or just the hair to the
You have to transplant it with some connective tissue, with some part of your skin and the gland.
and the
It's
gland.
not like your conventional na parang you're using tweezers and getting out hair. It's not like that. Kasi the idea is, the analogy is, if you do that, if you just pull out the hair, it's like you're getting the branches of a plant and planting it and expecting it to grow. But really, what you need is to get the root, the gut of the plant, and then plant it somewhere else for you to expect it to grow. Parang ganun.
Okay, and doctor, when you do this, when you get part of the skin or skin material and the basically the gland, no, for it to grow, um it does the hair then on the, let's say, okay, if you've already done the transplant, no, and then you put some from the back of the head to the top, and it does that hair that you transplanted, does it end up growing like regular hair, like normal
Yeah,
hair
just
does?
like your normal hair.
Okay, it grows just like your normal hair. Okay,
All right.
so that's the reason, because the roots are transplanted, because
Yes.
it grows from inside up, as you said, like the tree. No, if you just cut off the
Yeah.
branch and transplant, it's not gonna live. You have to
Yes.
have the root. Okay, now um when the hair that grows, sorry, when the transplanted hair on the newly transplanted hair site grows, is there a limit to how it grows, or would it grow as regularly as the hair when it was, like, let's say still on the
Yeah.
back of?
So it needs to retain its characteristic,
Mhm,
like how it was when it was in the back. Otherwise, if you put it here with the idea that it's gonna grow like what your hair here is,
mhm.
then it will eventually fall out. But kasi diba,
Yeah.
it's gonna be influenced by the hormone, but it's not. It will retain the characteristics of your hair at the back and on the side. A good example for you to understand is when we do a hair transplant and then put it on the eyebrow
Mhm.
for eyebrow hair transplant, it grows long like your scalp hair.
Okay.
So patients need to trim it
Okay.
every 2 to 3 weeks so that it doesn't grow as long as
Alright.
your scalp hair.
Yes. Okay. So you also do transplants for eyebrows, like people who have, let's say, missing patches of eyebrows.
Yeah. Yes. Especially for those who had an injury
Mhm.
or an accident and then they sustained a scar on their eyebrow. We
Okay.
do that too.
But whatever hair you transplant, wherever you transplant it from, it retains its qualities from the original site. So, okay, so because that's good news, because then you wouldn't want to transplant some hair at the top of your head that will only remain that half inch for
Yes.
that half
Yes.
inch, and or that kind of thing forever. So you mentioned, okay, that you do get the skin of the hair and the skin of a person itself. Has there ever been a case where somebody else has donated their hair to someone else, like with the actual skin?
No, you can't.
Okay.
So
What's
it's the idea is still like a transplant, like you're doing like a kidney transplant or a heart transplant. If you do a hair transplant and then you get it from someone else, well, there's only one case study that they've done, but this is for a patient who was also a kidney transplant patient. So
Mhm.
he's taking anti-rejection medications anyway.
Okay.
So if you do that just purely for hair transplant, then that patient needs to take medications for him not to reject that person's hair. And
Okay.
that will subject the patient to a lot of side effects of the medication, not really from the hair transplant.
Okay. So in a way, it could be done, but it's not done because it's not, as the benefits do not outweigh the risks.
Correct.
Unless, as you said, in that one case study, the person already had a kidney transplant. So the person
Yes, is already taking anti-rejection medications anyway.
and those are immunosuppressants
Yes,
because the body will might think it's a, it's a foreign kidney. Yes, it is, and then maybe it's a foreign hair follicle, so it might reject it. Okay, but
correct.
you wouldn't just normally put someone through a round of like immunosuppressants
Just for, yes,
for a hair transplant when they can donate. I mean, get the hair from their own body. And it's
correct.
okay. I feel like asking like a whole bunch of just fun questions right now, but I'll save it for later. I'll save it for later. Okay. So, doctor, can you tell us like who might benefit from a hair transplant? I mean, can you give us the profile of a person, typical profile of a person who like might come into your clinic or someone you've treated who
So usually, patient age more than 25 years old. Someone who has a receding hairline, like an M shape type of hairline, or they've lost their hair at the crown. Someone who can be completely bald from front to the back, but still has a lot of hair on his side and back would be a good candidate for hair transplant. A lot of patients will ask me, when's the right age to do a hair transplant? Really, as long as you're like above 25 years old and you've like lost a lot or like a part of your hair, like it's shiny bald already, you don't expect medications, topical or oral medications, to address that problem anymore. So you have to do a hair transplant for these patients. No more of like stem cell or PRP,
Yes.
topical medications. If the patient wants to see hair on that bald area, like if it's completely bald, then do the hair transplant.
Okay. Can we discuss stem cell and PRP briefly? Like just briefly, what are they supposed to do or meant to do, and how come they don't really work afterwards, or how come they're not recommended?
Treatments like these, will only be quite effective if you still have hair.
Okay. All right.
Meaning, even if it's like thin hair, as long as it's baby hair, miniaturized hair, as long as you still have some hair, it might be effective enough to thicken it out and prolong the lifespan of your hair. But if you do not have hair there anymore, it won't grow anything. So your PRP or like stem cell, exosome, they're more like putting fertilizer in your plant. If you put fertilizer in the soil and there's no more seed, nothing's gonna grow. So you have to it's more like a fertilizer. It's not the actual seed. Hair transplant is you're like putting the seed in the soil and then expecting it to grow. The other treatments, topicals, oral medications, they're more like an adjunctive treatment as long as you still have hair. If you don't have hair, do not expect these treatments to give you like a significant improvement.
Now, that's a great analogy, doctor. And I did like the plant. Actually, did like when I was a kid, so I completely get it. I still sort of like it, but I have a green thumb, but not for hair. For plants. Okay. So, okay. Well, doctor, I'd like to ask you to walk us through the steps of a hair transplant and, ask you what happens exactly in the preparation and all that. But before we do that, doctor, we do have to take a short break. So folks, stay tuned to this very interesting topic. And I'm gonna just ask you a few naughty questions later, perhaps, or maybe we can stick to the serious ones. I'm not sure. It's really up to you, Doc. Let's see like, who's in the mood and what. And somebody texted a question. Let's see if that question is going to air today. And just everybody hang in there. Stay tuned to Healthline with Makati Med. I'm your host, Nicole Jacinto. We're here with Dr. Melia, and she is a dermatology specialist, and we are specialist. Up with me today. maybe I have too much hair on my tongue. Ah, okay. Well, it feels like that today, certainly. But we'll be back, folks, with more information and yes, and with Dr. Melia explaining things to us step by step. So please stay tuned to Healthline with Makati Med. Hang in there. We'll be back in a minute.
You're listening to DZRJ 810 AM. We'll be right back after these reminders.
Hi, this is Dr. 𝗂𝗍𝗂 from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable at Makati Med Care Access, Araneta City. What's more, Makati Med Care Access is the only single-use hemodialysis center in Araneta City. It's now easier for patients to avail of renal care services right in the heart of Cubao. We offer health screening and diagnostic procedures in this facility at affordable rates. You can get services such as mammogram, ultrasound, lab procedures, ECG, and many others. We believe that access to affordable, quality, and compassionate healthcare is a basic human right. And we at Makati Med Care Access Araneta City are doing our best to make this possible to more people. You can find us at the ground floor of Manhattan Plaza Tower 1 in Araneta Center, Cubao. We are open from Mondays to Saturdays from 7 a.m. to 5 p.m. and Sundays from 7 a.m. to 4 p.m. For inquiries, you may reach out to us at the numbers below. We look forward to serving you here at Makati Med Care Access, Araneta City. This is Dr. 𝗂𝗍𝗂 from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable through Makati Med Care Access at 𝗛𝗶𝘶𝗵𝗹. Available for outpatient care services, our 𝗛𝗶𝘶𝗵𝗹 site offers consultation and diagnostic procedures such as medical assistance, hospital admission assistance, blood pressure monitoring, laboratory tests, and X-ray, among others. This is really convenient for those residing in Makati and nearby areas who do not want to go to the hospital to have these treatments and procedures done. We believe that access to excellent quality and compassionate healthcare is a basic human right, and we at Makati Med 𝗛𝗶𝘶𝗵𝗹 are doing our best to make this possible to more people. We are open from Monday to Saturday at 8 a.m. to 5 p.m. at the third floor of 𝗛𝗶𝘶𝗵𝗹 in Makati City. For inquiries, you may reach us at these numbers. We look forward to serving you here at Makati Med Care Access 𝗛𝗶𝘶𝗵𝗹.
You're back with Healthline, keeping you healthy. Moderated by Nicole Jacinto.
Welcome back to Healthline with Makati Med, folks. I'm your host, Nicole Jacinto, and we're here with Dr. Melia. We're talking about hair transplants today, and it's such an exciting topic for me because we've never talked about it before. I have never had the chance to extensively talk to a doctor, nonetheless, about hair transplants and hair transplantation. I've seen in the 90s, I used to watch a lot of those infomercials about hair, how to make your hair grow. They were just on TV all the time where I was. And, I'm not just the president, I'm a member too and all that. I don't know if anyone recognizes that. Don't tell. Then it can tell your age probably, or whatever kind of TV you've been exposed to. And so, Dr. Melia, we're going to talk about the actual hair transplant now, the process. But before that, can I ask you, how do you get your patients most often who walk in for hair transplant? And do they come in and they say, I want a hair transplant? Is that the usual case, or do you get referrals, or?
Back when I was still working overseas,
Yes.
the patients would come to you with their research done already. They know what they want. They know what technique they want. They know how far they want to go. Here in the Philippines, though, it's a different story, because here it's not that very well marketed yet.
Yes.
It's not something that a lot of people know that they can do as an option. So I usually get them as referrals. Another thing, some people, maybe 10-15% of them would be walk-in patients, but a lot, maybe let's say 30-40% would have done their research and have looked for their option to do the hair transplant here in the Philippines rather than doing it outside. Because there's a lot of marketing for like specific countries to do the hair transplant in those areas.
Yes. Actually, that was one of the questions that, well, the first question that came in earlier, actually very early into the show. It's a question from Rose. She was asking, like, how come not, it seems that not, you answered it already. So there's the answer for you, Rose. Thanks for tuning in, by the way, Rose. I think I know who you are. You don't speak up a whole lot, but thanks for speaking up today and asking that question. She was saying that it's good that you're talking about this on your show today, and that it's good to know that Dr. Melia in Makati Med offers it and can do it. And like, apparently, why isn't it as big a deal here as it is in other places? Okay, so thank you for that comment and that question, Rose. Okay, so doctor, okay, let's go through the steps. What happens during a hair transplant? Can we go through the steps in terms of one? First, when it comes to the consultation and preparation, how would, let's say, you said about 30 or 40% of your patients, please correct me if I'm wrong anytime, jump in and correct me if I misquoted you or anything like that, or if I need to get my facts straight. I am learning from this as much as everybody else is. A lot to learn from you. How do they get in touch with you for a consultation and all that? And then maybe we can go through the steps of the consultation.
So usually for my patients, they would do the consultation first. That's not on the same day that we do the surgery. That's like one day, like 30 minutes to an hour, sometimes even 2 hours, where we need to discuss the whole process, the downtime for the procedure. What takes quite long is, for example, the patient wants to rebuild their hairline. So drawing the type of hairline that he wants, marking that area from this to this is where we do the transplant, and then calculating how many grafts or how many hairs do I have to take out safely on his donor area, and then redistributing it on the part of the scalp. So all of that happens during the consultation. So I walk them through the whole process, show them what they need to prepare for, draw the hairline, or like mark that area, for example, because some patients, they don't use their hairline. They just use their hair here at the crown.
Yes.
So we have to map out that area and then calculate how many grafts or how many hair he needs in order to put volume or in order to fill that bald patch.
All right, doctor. Sorry, go ahead.
And then after that, I then walk them through like how long will it take for them to get back to work? When do they expect the results? If they do need medications after the transplant. So I walk them through the whole thing. Then the whole procedure is another day.
Okay. And then do you get more males or females who come in? And is that because of a scientific thing? Do more males experience hair loss than females do?
Males have that type of hair loss that's more obvious compared to females. But both men and women experience hair loss by the time they reach the age 50.
Okay.
Majority of my patients would be men, around 70 to 80%, and then around 20% women.
All right. Thank you, doctor. And okay, so you do walk them through the steps of everything that will happen, and then do you have like during the consultation, do you encounter situations where the patient wants this type of hairline, and then you say, well, we can do this, but not exactly that?
Yeah. Yes, because you have to first manage their expectations and then work with what they have on the back and on the side. Because other patients, they don't have a lot of hair. Us hair transplant doctors, we call their hair at the back and on the side their money bank.
Yeah,
if they don't have a lot to give, then we have to work with whatever they still have. So people can expect to have to go back to how their hairline was when they were a teenager, but then they only have a few hairs on the side and on the back. That's not going to work. Otherwise, it'll look funny in the future. They'll have a good hairline here, and then they lose further hair back. It's like a wall of hair. So you have to be able to plan it out, not just for today.
Yes.
But make sure that hair looks good 10, 15 years down the line.
And that's why it's important for the patient to really listen to you too, because you'd probably tell them something like, well, we don't want you to get the 𝗄𝗶𝘁𝗵 look in like 10 to 15 years if we exactly what you want. Okay, so happy to hear that you manage expectations also, and that patients, of course, will listen to you, because
don't overpromise.
Never overpromise, especially when it comes to hair. I'm sure a lot of hairstylists know that, like, oh my God, that's only a haircut, but that happens. Okay, so consultation and preparation. Now, how do you, the doctor, prepare for the actual are there any diagnostic tests that you need to take or anything like that for a hair transplant?
Just routine blood test. If depends on the patient's medical history, like if that patient has cardiovascular or other comorbid conditions, then I'd have to get more an individualized type of diagnostic test. But routinely, I would only need blood tests.
Yes. So that would be like the type of blood test where they don't have to fast for, or if they do have cardiovascular issues or anything, as you mentioned, then you probably, you just get a cardio. Do you need a cardio clearance?
Yes, you need a cardio clearance.
And then you do the usual.
Although the whole procedure anyway is just local anesthesia.
Yes. Okay.
But
still, you play it safe as a doctor. You do what's best for your patient. Thank you, doctor. Okay.
Yes.
And how do you ask the patient to prepare for the actual day of the procedure? Is it technically a surgery or procedure, or how shall I call it? The hair transplant itself?
It's a surgery. Yeah, hair restoration surgery.
Okay,
it's an outpatient. It's an outpatient procedure. The patient doesn't need to be admitted at the hospital. He comes in the morning of the surgery. I make sure that they wear like a button shirt from all the way down, because some patients they come to the clinic wearing a t-shirt, and then it becomes difficult for them to wear that t-shirt back once the surgery is over without touching the grafts. So it needs to be a button shirt.
Good idea.
Patient can eat. It doesn't need to be NPO where other surgeries. Oh, you can't eat by midnight. It's nothing like that. I ask the patient to refrain from doing any activities or like drinking, smoking a few days before, and to not drink any coffee during the time of surgery. That's it.
Okay. No coffee during the time of surgery.
Yeah.
Okay. But before, like a few days before, they can.
Yeah, they can. No problem.
Why coffee? The caffeine.
It's just because the procedure takes a long time.
Okay.
Usually, depending on the number of grafts they need, it
Mhm.
might take them around 6 to 10 hours,
Mhm.
sometimes even more. And so, if the patient, because it's in local anesthesia, if the patient is wide awake during the whole time, it makes them more agitated. So, if you're drinking a lot of coffee and then you're just waiting for the procedure to be finished, it makes them more anxious. That, oh, when is it gonna
Yeah.
end? Something
Yeah.
like that.
Okay, so on the day of the surgery, you did mention it. The surgery itself can take a long time, and it's an outpatient surgery though, and you said it could take maybe up to 6 to 7 hours. What's the shortest you've ever done? What's the shortest hair transplant surgery you've ever?
If it's depends. If it's a small procedure, can be like 3 4 hours. If it's just like a small patch here, if it's a repair, like for example, just putting hair on a place that is a scar,
Mhm.
probably 2 3 hours. But it can go as long as 12 16 hours.
Mhm. Especially if they want, let's say, I would like a widow's peak plus
Ah,
this.
yeah.
Yeah,
There are patients who are like that. They just want the widow's peak, or other patients who would want their temples
Mhm. I they
repaired,
they
because
want.
there are people who have wide forehead, and so in order to narrow it, to make it more narrow, they put the temples back in.
Mhm.
So sometimes it's just like a very small procedure.
Okay. All right. And then it's during the procedure itself that you, I don't know if I'm using the prop quote unquote harvest. Now I'm also talking like planting harvest, the how do you say it, like the hair that you're and skin that you're gonna transplant, and then you plant it or put it in.
Yeah.
So, okay. Does the patient experience any discomfort or pain
The
during?
first few injections, there would be some pain,
Mhm.
but then after that, probably not. The
Okay.
most discomfort that they would feel is when they're lying down,
Mhm.
and then they're lying down at that same position for a long time.
Mhm.
That's the discomfort. It's not because of the actual surgery, but because you are in that same position for a long time. Sometimes your neck gets strained or your head gets strained, something to that effect, but not really because of the procedure.
Okay. Then you mentioned that you use local anesthesia. Are there patients who say, I just like to sleep during the process, or do they need to be awake to check out their hair? And is this okay with you? Is that okay with you? Or do you prefer that they not see what's going on at all during the surgery?
Um, it depends. Some patients they want to see, but I would prefer for them not to like check on it like every time. Some actually most of my patients would prefer to be asleep during the procedure and then just wake up. Then oh, it's already finished.
Yeah, of course. Yeah. So you don't, do you ever get any occasions where there is a patient, "Oh, I want to see you now in the mirror, like every 5 minutes," and you're like, oh.
Uh, Usually, what happens is that after the procedure, I let the patient check.
Yes.
Okay, so this is the hairline, and
Mhm.
then if they want any corrections with it, then we can correct
Okay, so you do it right there and then.
after.
And then
Yeah.
after, okay. And then of course most patients, as you said, would a lot of them would prefer to sleep and just wake up when it's done because you get impatient sitting there and or lying there in a certain position. And as you said, that's where most of the discomfort comes from. Are there any patients who have needed in terms of certain patients, have you encountered a situation where, okay, you've been doing it for 6 to 7 hours, they've been getting local anesthesia in these areas, but for some reason, whether it's the process or the patient, like having maybe being more tolerant to the anesthesia, that you'd have to do a few sessions to get one result.
In my practice, no.
Okay.
No, but I do have heard of other people splitting it into 2 days, especially if the grafts or the number of hairs that needs to be planted is a lot. So they split it into two.
So the term planting is correct. It's just the harvesting where's I don't know what term how do you call it? How do you actually call it? I'm
Yeah,
calling
that's the correct term.
it. So we really are talking agriculture here. Just-
We're
okay.
like farmers.
Yes. Yes. I come from a line of farmers, so there. Okay. So that's great news for people to hear. You have heard of others doing 2 sessions just because it might take long, and perhaps the patient prefers that to come back like 2 days in a row instead of being there longer, because a lot of people can also get impatient during the whole thing.
Yes.
Okay, during procedure, what happens if someone says it's been 2 hours, I need to pee?
You can.
Yeah,
The patient can take break at any time during the procedure because it's local anesthesia, and it's more like a twilight anesthesia where you can wake the patient up anytime. If he wants to take a break and go to the restroom or have a little snack, it's fine.
Okay, so that's fine. You can eat, just
Yeah.
you don't want caffeine because it
Go
makes
to the toilet, it's fine.
and they can take the regular medicines on that day.
Yes, they can stretch. If, like, for example, they're feeling strained, they can stretch,
Can stretch,
walk a little bit. Yeah.
run a mile, come back. No,
Oh no.
then but would you tell them to stay off to stay off blood thinners or anything like that? Is that the type of
Yes. So usually we ask them to stop taking blood thinners or anything that will give that same effect, like ginkgo biloba, fish oil, vitamin E for 1 week.
My gosh, you are so familiar to all the supplements that everyone takes and forgets to tell the doctor that, by the way, I'm on this, and by the way, I'm
Yeah.
on John's wort, and by the way, I'm on.
I get the most random things. Like some people will tell me, oh, I have natto, the Japanese like bean.
Okay.
Natto that is also like a blood thinner.
Mm-hmm. And
So yeah, I've experienced a little bit of like some weird things that
like,
have caused some bleeding during surgery.
yeah, so you have to tell your doctor everything. Like, it's just a
Correct.
vitamin. No, vitamins have effects as well. Yeah. So thanks, doctor. Okay, now, you walked us through the process, and some maybe other doctors or patients would prefer to, to have the one thing that will take long split. It is there any risk for the patient for the surgical hair restoration is in terms of like wounds or infections during or after the surgery? Like, what is it? Are there any risk associated with that?
Yeah. So the most common that you'd probably expect are pimples on the area.
Oh, okay.
If it was done in a more like
Less medical.
unclean setting, infection.
Actually.
The most like dreaded complication would be necrosis or the skin
Dying.
dies.
Mhm.
And another one that I guess most patients would dread is that the hair doesn't grow at all.
Okay. So those are risks they take, but in a where when you conduct it, you do it in a hospital, are those risks lessened?
Yes.
Okay. Simply because of the protocols, the procedure, the cleanliness, and
That's correct. And I've like experienced some patients who choose to do it in another country or like outside. But the thing with that is that the follow-ups
yeah.
are gonna be very difficult. So there is no like proper monitoring after you've done the procedure outside the country. So if, for example, there are things that needs to be done a month or two after your surgery, you don't know.
Mhm.
So if, for example, you do it in a hospital setting like in Makati Med, Then you can have your regular follow-ups after your surgery, where everything gets to be evaluated after the growth of your hair. When do you expect your hair to grow? If there's some hairs that needs to be pulled out, because otherwise it's going to grow into a cyst or a pimple. So all of these things can be addressed.
Okay. And before we go to the aftercare, which you've already started talking about, can we talk about the necrosis? How does that usually happen? So necrosis is when the skin dies.
Yes. So sometimes in a procedure, there might be people who would plant too many, hairs at that same spot. And so the blood flow to that area becomes compromised. It's like when you're planting also. If you plant too many plants on that specific area, they're going to compete for the nutrients, they're going to compete for the blood flow, and eventually just one or two plants will grow, not all of it. So really the right amount of seeds need to be placed on that area. It cannot be too much.
That's why it has to go to an expert. Like, this just reminds me, just last week I was saying, can you please take out those other plants from there in the garden? Like, we gotta get this done, because you don't understand. You planted it next to the wall, and then it's there, and the roots have nowhere to go. I mean, it's just
Correct.
like roots have nowhere to go. It's gonna die anyway, Okay, but
Yes.
that's a great way of. So it's basically, it's not getting enough nutrients. There's not enough blood getting to that area with the nutrients that it needs. So instead of having more hair in that one area, that area ends up kind of dying. Okay.
Yes.
Okay. Thank you, doctor, for making that so clear, like how that happens. And also, okay, so the after transplant treatment, the follow-up, can you sort of take us through how that happens? So immediately after and in the following days, like maybe, I guess, instructions you give the patient. Is there any discomfort, any medication, and then after that, the follow-ups? So
Okay, so the most important thing that I tell my patient is that the post-op is the most difficult part of the surgery. It's the waiting game. You don't expect the results after 1, 2, 3 weeks. It's after 4 to 6 months that you see some of the little hairs start to grow. It's really like a plant. You don't expect the plant to grow after just planting it a week before. So the waiting game is the most crucial part. And then when it comes to the implanted hairs, it's gonna be intact, or it's gonna stay intact on your skin by 5 to 7 days. So the most crucial time wherein you need to take care of your transplanted grafts, you make sure that you avoid any like activities that makes you sweat, you avoid bumping your head, you avoid scratching your head. That's 1 week.
okay,
After that, everything goes back to normal. Well, except for swimming, or for patients who like surfing, swimming at the sea, 1 month.
okay. So just to reiterate that, the first 5 to 7 days is the most crucial, and you should avoid activities where you sweat in that area of your head. And for the areas that were transplanted, and then that's when it really, I guess, needs to take hold, no?
Correct.
And also you avoid hitting your head, bumping it, pulling your own hair out from frustration. And then after the first week, back to normal, except for swimming and surfing. How come? Why swimming and surfing?
Just because that we want to avoid any potential infection.
Okay.
It's the sand.
It's the
You
sand.
can't really tell. Plus, it dries your scalp. So we want to make sure, like, if you get sunburn in your scalp during the time that you're waiting for your plants to grow, it's like, if it's very dry soil, it's not gonna grow well. So it's the same. It's the same idea.
And for what if a patient say, well, I swim in a pool and it's chlorinated? What do you answer that patient?
2 weeks.
Weeks. Okay.
Yeah.
And people
We
still
wait 2 weeks.
no, I'm just kidding. Well, they do. All right. So, yeah, okay. Is chlorine too harsh? How about shampooing and all that? Do you give them like don't shampoo it, or is it the same?
We give them like a baby shampoo for a week, and then after that, patient can go back to their regular shampoo.
Okay. And it won't really affect the hair, the growth or
No.
anything. Okay. All right. So will they feel any discomfort? Is there pain afterwards aside from, and you mentioned the pain of like enduring the wait, the waiting time. How about any physical discomfort or anything like that?
Pain scale might be 2 to 3 out of 10.
Mhm. And
Like 1 or 2 days after the surgery, but it's more when you apply pressure. For example, you lie in your bed with the pressure on the pillow, that's when you feel the pain. But if there's no pressure on your head, then there's no pain.
okay.
Minimal pain. Probably more itching than pain.
More and what do
Because
we
it dries up. The
Yeah.
wound dries up. Like with any regular wound, once your wound dries, it turns into scab. And once it scabs, it becomes itchy.
and if you scratch it and pull it out by accident?
If you scratch it after like 7 to 10 days, doesn't matter.
Okay, but before that, tie your hands to your sides.
Yes.
I mean, remember when my mom.
It's not going to be that itchy anyway during that time. It starts to become itchy after 10 days.
Okay. All right. Well, okay. It starts to become itchy after. Well, with growing hair, it can itch, especially in the most how shall we put this, inconvenient of places. Okay. So, all right. And then do you give them any medications that help the hair grow or any type of like antibiotics or anything like that?
Usually we give them like prophylactic antibiotics, but if you know that you've done it in a sterile setting, you don't actually need antibiotics.
Okay. All right.
It's more like for prevention, but not really because of an ongoing infection, no.
So it's actually, I would say, a bit less than like when you go to the dentist and they say, oh, you should take some antibiotics just to prevent any kind of infection, but it's probably less serious than that even, no?
Yes.
I mean, there's less chance of an infection developing.
Correct. Because it's quite superficial. It's only up to the dermis, subcutaneous tissue.
Okay. So, okay, doctor, considering all of, from consultation to scheduling the surgery and then the actual surgery and also, the aftercare, in total, like, how much time does it take for the whole thing to come together? Oh, by the way, the follow-up checkups, how many times should they go? Do you recommend they go to you for follow-up checkups? Like how many times do they usually have to go within
If the patient is amenable to follow-ups once a month, then once a month.
Okay.
But if not, it's usually after a week from their procedure and then once every 3-4 months.
Okay, once every 3-4 months. Okay, and then so the whole process. You did mention a 6-month period, but is that the typical period or like just the waiting game after 6 months?
1 year.
1 year. Okay, 1 year.
For the patient to say, this is the actual result of my transplant. It's 1 year.
All right. Okay. All right, doctor, I have more questions for you, just a few more questions, but we do have to take a short break. So folks, we'll be right back. Stay tuned. Doctor, I just will have a few more questions for you when you get back. Some of them are fun. I can't help it. They're fun questions. Yes, okay. But folks, thank you for staying tuned to this great show, and stay tuned because we still have more to come. We'll be right back after these few reminders.
You're listening to DZRJ 810 AM. We'll be right back after these reminders.
Hi, Hi, this is Dr. 𝗛𝗶𝘁𝗵 from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable via Makati Med Mobile Care Access. As the name suggests, this service is mobile, which means that we go to where you are. Mobile Care Access deploys a team of professionals for face-to-face consultations and to conduct basic laboratory and diagnostic procedures, as well as vaccination and testing, depending on your needs. We can go to any location of your choice within the metro and readily offer these healthcare services to communities or groups. For added convenience, different modes of payment are available, including HMO benefits for those with a valid letter of authorization. We believe that access to affordable, quality, and compassionate healthcare is a basic human right, and we at Makati Med are doing our best to make this possible to more people. For inquiries, scheduling, or pre-registration, you may reach out to us at the following numbers. We look forward to coming to you and serving your community with Makati Med Mobile Care Access. Hi, this is Dr. 𝗛𝗶𝘁𝗵 and welcome to Makati Med Wellness Center. Located at Ayala North Exchange, the Makati Med Wellness Center is a warm and comfortable state-of-the-art lifestyle center where executive checkups and services that address holistic patient care and wellness can be done. We have a skin and laser hub, diagnostic imaging, health screening, mind and wellness care, and physical medicine and rehabilitation. The Wellness Center is equipped with modern facilities and staffed with competent healthcare professionals who are committed to deliver premium, personalized, and easy access healthcare services for both adult and pediatric patients alike. This is a great place to prioritize your health and well-being without having to be at the hospital setting. We are open from Monday to Saturday at 7 a.m. to 5 p.m. at the 7th floor of Ayala North Exchange, Tower 1 in Makati City. It is also accessible from the Makati Med Hospital through a bridgeway to Ayala North Exchange. For inquiries, you may reach us at these numbers. We look forward to serving you here at Makati Med Wellness Center. To serve you in convenient locations where you can avail of premium but economical healthcare. The Makati Med Care Access Araneta City is where we offer health screening and diagnostic procedures. Here, you can get services such as mammogram, ultrasound, lab procedures, ECG, and many others. What's more, Makati Med Care Access Araneta City is the only single-use hemodialysis center in Araneta City. This makes it easier and convenient for patients to avail of renal care services right in the heart of Cubao. Here at 𝗛𝗶𝘁𝗵𝗹𝗁, another Makati Med Care Access Clinic is located, offering outpatient care like consultation and diagnostic procedures such as medical assistance, hospital admission assistance, blood pressure monitoring, laboratory tests, and X-ray, among others. This is really convenient for those residing in Makati and nearby communities who do not want to proceed to the hospital to have these treatments and procedures done. The Makati Med Wellness Center, located at Ayala North Exchange, is a warm and comfortable space where executive checkups and services for holistic patient care and wellness can be available. In this wellness center, we have a skin and laser hub, diagnostic imaging, health screening, mind and wellness care, and physical medicine and rehabilitation. It is equipped with modern facilities and has competent healthcare professionals who are committed to deliver premium, personalized, and easy access healthcare services to adult and pediatric patients alike. It is connected to the main hospital by a bridgeway at the side of Ayala North Exchange. To make our services more accessible to certain areas, the Makati Med Mobile Care Access was launched. As the name suggests, this service is mobile. We go to where you are. Mobile Care Access deploys a team of professionals for face-to-face consultations and to conduct basic laboratory and diagnostic procedures, as well as vaccination and testing, depending on what your community needs. We can go to any location of your choice within the metro and conveniently offer healthcare services to fit the needs of any community or group. For added convenience, different modes of payment are available, inclusive of HMO benefits for those with a valid letter of authorization. Now that is truly accessible healthcare. All these additional locations under Makati Med Care Access are meant to make it easier for more people to avail of our services. After all, access to affordable, quality, and compassionate healthcare is a basic human right, and we at Makati Med are doing our best to make this possible to more people. For your healthcare needs, please visit us at the following Makati Med Care Access Centers or contact us to come to you and allow us to take care of you.
You're back with Healthline, keeping you healthy. Moderated by Nicole Jacinto.
Okay, welcome back to Makati Med. I'm your host, Nicole Jacinto. We're talking about hair transplants. Okay. That's again. How are you again, doctor? Still okay?
I'm okay. I'm okay.
Okay. All right. Now, of course, this is a serious topic. And I do have a few fun questions, though, to ask you.
Okay.
I understand that there's also a psychosocial aspect to it, which maybe we can get to in just a couple of minutes. That I'd like to ask you about, people who suffer from hair loss and then avail of hair transplants and all of that. But before we get there, oh yes, you did say earlier that well, I guess this is part of the fun question portion. What happens? It's about 1 year, you said, before a patient can say from consultation to the procedure to any to the healing to waiting for all the results to show that they can say this is the actual result, and what my completed hair transplant looks like. Have you ever encountered any case where a patient will, even going through that whole year thing, will come back and then say, what, I kind of changed my mind, I want a different look? Have you ever?
Yeah.
Okay. And then so you resume the whole process again?
I've encountered patients, for example, who requested a low hairline, who would push you to, no, I want my hairline to be this low, or I want a widow's peak.
Yes.
And then after 3 or 4 days that they've looked at themselves in the mirror, it doesn't suit me. And then they'll ask you to pull it out.
Yeah.
Yeah. So I've encountered a few patients who are like that. And really, if they wanna correct it or make it in a different type or shape, then I have to pull out the hair one by one using the technique on how I pull out the hair at the back. Because by that time, that's already planted already.
Yeah. So it's
although there aren't the very minimal scar after that process anyway.
Mhm. Okay. Okay. So, because that does happen. You can't always blame the patient, and
Yeah,
definitely doctor if you discussed it, and then, it just so happens that when it's there already, it's not really what you wanted.
correct.
All right. So, have you, um, okay, a bit. Have you ever had like, a request where, or have you heard of any request where somebody wanted like long hair in one area immediately transplanted? Like, let's say
Yeah.
they have a mullet, okay, or something like that, and they want that long hair there already, and like they want like a funky hairstyle sort of immediately.
So ideally for when you do a hair transplant where you take out the hair one by one, you have to shave your hair. But
Okay.
there is such a thing as a long hair transplant wherein you don't shave the hair and you take out the hair when it's still long, like
Okay.
really long.
Really long.
Not really because of like crazy request, but for example, the patient is
I want short
having
hair.
their wedding
Yeah. Okay.
or has an important shoot wherein you can't shave your hair.
Yeah.
Usually I get it for like weddings. And you
Right.
can't really be like for men or for women who want like a smaller face shape for women. You don't want to end up with the shaved hair
Yeah.
here or shaved hair at the back. So you transfer it long.
Okay. All right. And then if they happen to come to you when the hair is still short, you say, okay, we gotta wait like 2 months for it to grow out or something like that to the length that you want. Does that ever happen?
No. You can
Just
take it out at any length.
at any length. Okay. All right. And does transplanted hair turn white also eventually?
Yes.
Okay.
It's like your regular hair. It's not like a mutant hair.
Okay.
Of course, it's gonna turn white. If, for example, you get it and it's already white, don't expect it to be black. It's gonna be white.
Can you dye transplanted hair, or is that
Yes,
something?
you can. You can dye your hair.
Okay. All right. So you can dye transplanted hair. And then has anyone ever requested you? Well, no, well, if it's the person's hair, but let's say they have different hair, it's not always the same color in every region, right? The way it grows out.
Correct.
That they want this like sort of mousy brown type here on top so that it'll look like a more natural thing, and then the darker brown there, like, kind of different thing
Uh,
transplants
my
technique.
my usual request would be for me not to put the white hair at the front. You
Okay.
put it and blend it towards the back because they don't want the white hair at the front.
They want the
That's
salt.
my usual request.
They want the sort of salt and pepper look as
Yeah.
opposed. Okay. All right. Okay. Has anyone ever like gone to you and for some reason they just don't have enough hair on top of their head or whatever, but they wanted more? Have they ever had hair from any other part of their body transplanted to their head?
Yes. So the most common is the beard for men at least. That's where we get the hair. So because it's the most like similar to your scalp hair and it's thick hair, but we don't put the beard hair at the front.
Mhm.
We blend it at the top area or the mid scalp region
Okay.
so that it gives it more volume. But because the beard hair is not as natural looking as your scalp, we don't put it at the very front.
It's a bit tougher, I would assume, or
Yes, it's a bit thicker.
thicker. Okay. Has anyone ever had hair from, let's say, their armpit or leg or other regions transplanted to the top of their head?
The most would be chest hair and leg hair, arm hair. But
Okay.
because these types of hair are really like quite different compared to your scalp hair, majority of them are always in the shedding phase.
Okay.
So when you take it out and then you plant it in your scalp,
Mm.
you only expect 30% of those arm hair or chest hair to grow.
Okay.
So the
Yep.
survival rate is quite low. So we don't usually use them. Like it's quite last resort already
Okay.
for me to use them.
All right. Okay. Thank you, doctor. And okay, have you ever encountered any cases where like during the consultation and before the transplant, you find out the patient has 𝗠𝗸𝗁𝗁𝗃, and then you tell them to get rid of it first before you transplant their hair.
Yes. So usually if you have pediculosis, you treat it first. Any sort of hair scalp condition, you have to treat it first before you do the surgery. Because of course, if you have pediculosis or like your kuto, then there is some risk for infection because it's gonna be itchy.
Yes.
And then you start scratching it. So
can you get 𝗠𝗸𝗁𝗁𝗃 with transplanted hair?
no.
No.
Like what like for example, you have kuto from someone else?
Yeah, 𝗠𝗠 from someone else. Like
Yeah,
that's
you can. You can.
completely normal. Okay.
Yeah, it's completely normal.
All right. Okay. Thank you, doctor. Now, back to some of the let's see, more meaningful questions. Obviously there's the aesthetic, but can you tell us the other benefits of hair transplants? Like, I don't know, in a psychosocial sense, perhaps. And do you find that well, maybe we can start with that question.
In a sense, hair transplant really is something cosmetic. But majority of my patients, and I get them all the time, they'll tell me how much of an impact their hair has, like bringing back their hair has given them, how much of an influence, like how much of a confidence boost it has given them. Because for such a long time, like being bald, well, at least especially for men and even for women, it's more like a
You find it just
stigma, or like they think of it as a way like, oh, if you're balding, just accept it. It's part of aging. If you're starting to get bald, oh, just shave your head.
yeah.
But then once they see that option that they can do a hair transplant and they can enjoy their years, their younger years, or even their older years with hair, then why not? Right? Why not live your life the way you want it, or how you want to enjoy it? Because you only live once.
Yes, exactly.
Most of my patients would tell me that you only live once.
Do you find that the stigma is related to gender roles in our society and culture, and like individuals have been impacted by basically the traditional gender roles or the patriarchal gender roles that we've all been affected by?
Yeah, in a sense, yes, because especially for men, men are told to, if for example they're losing hair, that if you're bald, it's more masculine. Some people would think that way.
Yeah.
Like, just shave your hair. It's more masculine that way. But they're not given that avenue to say that I want to keep my hair.
Yeah.
I want to restore my hair, when there really is an option. So people should be more like accepting, or should be more aware of their options. It's not something to be ashamed of.
But at the same time, if, as you said, and as your patients say, you only live once, if you want to live with more hair, then go for it. It's not.
Correct.
And for women, do you find, like, how do you find they react to what is their more of the stigma that you see in society when it comes to their hair loss or their hair transplants?
For women, it's the same. They think of it like, oh, you have to embrace aging, embrace that it's a part of your life. Basically, the thought is that they really can't do anything about it when they actually can.
Okay. All right. Thank you, doctor. For patients of hair transplants, what is the long-term outlook? Like, is it successful mostly? What's the success rate for it being that way for the rest of their lives? Like, let's say they get it done early at 25 or 27, 30, and then like do you expect that something, are they to expect that they'd have to have something redone 20 years down the line, or it's
Depends. It depends on how extensive their hair loss is. So for example, you only did hair transplant at the front, but your family history will tell you that your father, your grandfather lost his hair up to the back. So you know that your hair transplant is definitely gonna stay. But then if you don't do anything about your hair at the back, then you lose that hair eventually. It's programmed to go based on genetics.
okay. All right, doctor. And then I guess for our final words for this show, because I'm told we're running out of time. What's your advice to people who'd like to get a hair transplant, who may have thought about, who are thinking about it, or whom may want to give people they know some information about hair transplants?
First, you do your research when it comes to hair transplant. Don't just rush into things, because your hair here at the back and on the side, your money bank is not limitless. Once you go to a doctor and for some reason it doesn't turn out the way that you want it to turn out, that hair that he or she took out or they did the surgery on will not grow anymore.
Yeah,
so where they took out the hair, so it's very precious to you. Make sure that you go to the right doctor, do proper consultation, have enough research for you to be fully committed with doing the surgery.
Okay, thank you, doctor. Is there anyone you'd like to say hi to, or bye to? Is it?
Just hi to the Department of Dermatology of Makati Medical Center, and also to my family. Hello.
Hey, hi to your family too. I can see you have a great head of hair on you, so I'm not worried about your genetics when it comes to hair loss. And also hi to the Department of Dermatology too. I'm sure if you can see me on screen, there's so many things you guys want to do to my face. You're welcome to do it once if you can get me in there. And I remember hi to Dr. Val, who I'm not sure if she's still there. I think so. All right. Well, thank you, doctor, for being on the show. Please
Thank you so much, Nicole.
talk about any topic. And any topic, any medical news, or we can talk about transplants again. Such a great topic. And I really enjoyed having you on the show today. Thank you for indulging me with my questions. Take care, doctor, and take care out there, folks. Take care of your hair. Okay. That's it for today. We'll be back next
Thank you.
from Makati Med. Bye now.
Thank you for tuning in to Healthline with expert doctors from Makati Med, giving you the chance to interact, uplifting your lifestyle. Moderated by Nicole Jacinto. Tune in again next week for your week.
The views and comments of the hosts and guests are not necessarily those of the station.